Hello everyone, I'm Dr. Ashish Reddy, consultant microsurgical andrologist, Andro9 Hospitals, Begumpet, Hyderabad, India. Today we are going to discuss about the commonest causes of male infertility and what are the treatment options and what are the investigations which we do so that we understand what is going wrong. So one of the major cause for male infertility. So coming to causes, first cause if we take, first will be varicocele. So varicocele is a condition where the testis doesn't get enough blood, or if there is a pooling of the blood in the testis, this will cause male infertility. So what are the grades in varicocele? So commonest grades which we see in varicocele is grade 1, grade 2, grade 3 and grade 4. So grade 1, grade 2 are generally the dilatation of the pampiniform plexus. So grade 3 and grade 4 where the most number of veins which supply the testis will get dilated. The problem with the dilatation of the veins is there won't be enough blood supply to the testis, or the blood which should be going back to the heart is getting pulled up in the testis. So this will cause stasis of the blood in the testis, and with this problem the sperm production might be affected, or the motility or the morphology of the sperm is affected, or in some cases at least 10% cases of grade 3 or grade 4 varicocele can go into azoospermia. So this is the one of the major cause for the infertility in males. So male infertility, when we take if we randomly check infertile cases, in every 100 cases there will be at least 40% cases where the infertility is caused due to varicocele. So next common cause of male infertility. So when we see the next common cause for male infertility, the most important thing is hormone imbalance. So what are the hormones which you need to test? So one of the major hormone we need to test is testosterone, and total and free. Second common hormone which we need to see is follicle stimulating hormone, or FSH. Third hormone is luteinizing hormone. Fourth hormone will be your estradiol, that means estrogen levels. Fourth will be your prolactins. So these are the commonest hormones which you need to check. If there is any abnormality in these hormones, you need to, if it is too high, we need to reduce it. If it is too low, we need to increase it. By reducing it, the sperm count can become better, or if it is too low, we will do a replacement therapies where we start you on some injections which will improve your hormones to normal levels, and which will in turn improve your sperm numbers, quality and quantity. So this is coming to your hormone. And third most important thing is your semen analysis. So semen analysis, how do you need to get it tested? So before giving for semen analysis, you should have at least 48-hour gap, avoiding sex or masturbation or night falls. See, if these three parameters are met, you have completed 48 hours, then the maximum timeline to stop giving your test is 7 days. So the test should happen from the day 2 to day 7. So this is only 5 days window you should maintain before giving semen analysis. And when you are giving for semen analysis, make sure that the test should be done within 30 minutes of your semen analysis. So after 30 minutes, the chance of a sperm dying is high. So always make sure you should return the sample to the lab within half an hour. So how to collect this sample? The commonest methods to collect this sperm sample is by masturbation, and there is also a myth that it can't be collected by any other means. Yes, it can be collected while having intercourse. You can have intercourse with your partner, and in that time also make sure that you collect the sperm completely. So how to collect this sample? This sample should be collected from the first drop to last drop, because the first drop of the semen will have highest number of sperms. So it's always, there should be never a spillage. If there is a spillage, it's okay to discard that sample and wait for again 48 hours and please re-give the sample again. This will make sure, this will definitely help us to get this proper testing done, and that will help us in the treatment of the patient. So this is coming to the testing. So what are the commonest treatments available? So the commonest treatments is most of the cases where when we start on the drugs, automatically patient will improve, or in some cases we need to correct the varicocele problem first and wait for 3 to 6 months so that the sperm will definitely improve. So these are the treatments. Then what is a treatment when there is a zero sperm? So when there is a zero sperm, always understand that there are two types of zero sperm. One is obstructive zero sperm and the non-obstructive zero sperm. Obstructive zero sperm is there in 95% of cases, because see, in a scenario like India, the infections are high. So any urinary tract infections or any infections like TB might cause obstructive azoospermia. In this obstructive azoospermia, when we see the obstruction, we will relieve it so that again the sperm count will become normal. Now coming to non-obstructive azoospermia, the major cause for non-obstructive azoospermia is hormone imbalance. When the hormones is not balanced in your body, this will cause non-obstructive azoospermia. In that cases also, we can definitely optimize you and definitely we can try to find a sperm in microtesticular surgeries. So we will be discussing about microtesticular surgeries in our next video. If you have any doubt, please contact us at Andro9 hospitals, or you can call us on our Andro9 numbers. Thank you so much.